What's definitely changing in Canada is our awareness of the disease. We read about it, we hear about it, and of course we know people that are afflicted by dementia and Alzheimer's. In a previous society, culture, we used to keep this in the closet, as it were. We talk about it more. But also we have an aging society, and the incidence of dementia rises with age. So over the age of 65, we will have as many as 5% of Canadians affected by some form of dementia, and over the age of 85, that can go up to 30 or 40%, perhaps 50%. So we have more dementia in society because of our aging population, and we're more aware of it. When dementia starts, by definition, the first thing that suffers is memory, particularly recent memory. But many of us have subtle memory loss. Do you ever go upstairs and forget why you went there? To qualify as dementia, it needs to be associated with other significant losses, even right from the beginning, such as difficulty with language or language ability, or orientation to place, or complex decision-making and reasoning and retention. Memory comes first, and these other things are quickly associated with it, often in a subtle way to begin. That's Alzheimer's, the commonest cause of dementia. About 3/4 of patients with dementia have Alzheimer's. Another common cause of dementia is strokes or vascular disease inside the head and the brain. And that can present differently. It can start suddenly with loss of functions such as complex decision-making, with memory loss coming later. Dementia is not a normal part of aging. There are some rare forms of Alzheimer's disease that are hereditary and can present in the 40s and 50s, but that is quite rare, a few percentage of all patients with dementia. Otherwise, it tends to present after age 60, after age 65, an increase in the 70s and 80s. Normal aging often leads to some subtle loss of certain memory, but tends to be stable and minor. What does decline with aging alone is our rate of learning and our rate of retaining new information, but not associated with inability to perform our normal daily functions, and not associated with disorientation, language problems, and other issues that are associated with dementia per se. Dementia has memory loss, disorientation, language problem, behavioral issues, and these are progressing gradually. They're definitely deterioration of previous levels of function, and ultimately lead to inability to cope with daily life. That is not a normal part of aging.